Hi everybody, this is Kat from 9 Health, and this is The Health Happens, our weekly Facebook Live show that we do to bring you all the health education information that you need. This month is Immunization Awareness Month, and if you've tuned in recently over the last couple of weeks, we've talked about shingles, which was last week, and the previous week we talked about the flu, so the flu vaccine. So the flu shot is already available, and you can get a free one at a 9 Health fair. We have them available at 16 different fairs in the fall. Starting September 10th is when the season starts, and you will be able to get free flu vouchers at all of the fair locations this fall. So today we're talking about preventing pneumonia, and we have Dr. Megan Leeds from Regis University School of Pharmacy. So I guess to get started, what exactly is pneumonia?
So pneumonia is caused by the pneumococcal bacteria. So it's a bacterial infection that can result in pneumonia, which is an infection of your lungs, bacteremia, which is an infection of your blood, and then meningitis, which is an infection of your spinal cord and brain. So it has a couple different ways it can present, and those are very serious. It can also present as an ear infection or a sinus infection, and those are less severe, but the pneumococcal bacteria is that what actually causes pneumonia, and that's our most common presentation of it, which is the lung infection.
Got it. So what kind of vaccines would we be able to get to kind of protect against pneumonia?
Yeah, so there's two. PCV13, which is also known as Prevnar 13, and there's a lot of acronyms, so I think it's sometimes easier to just refer to it as Prevnar. And then there's PPSV, which is Pneumovax 23. And so PCV13, the 13 represents the 13 strains of pneumococcal bacteria that it covers through, and then the Pneumovax 23 is 23 strains. And so most children get PCV13, so Prevnar, at ages 2 months, 4 months, 6 months, and then between 12 and 15 months. So by the time a child's 2 years old, they'll have had their 4 doses because pneumonia is very common in children under 2, and then adults over 65, which is where that Pneumovax 23 comes in.
Got it.
For that population.
Perfect. And how serious is the pneumococcal disease in the U.S.?
So about 900,000 people get it each year. About 400,000 of those are hospitalized. So it's pretty, can be pretty severe, and about 5 to 7% of those end in death. Again, it's very severe, and you want to be careful in children under 2, those with immunocompromised, COPD, asthma, certain medical conditions. If you're a smoker, you're much more likely to get pneumonia, and then those over the age of 65, it can be more severe.
Okay. And just as a follow-up, what kind of things should we be looking for if we might have pneumonia, symptoms?
So it can sort of present like a common cold, but it's a very serious lung infection, and so if it's persistent, if you just sort of can't get rid of this sort of chest congestion, especially if you are in the hospital and then get it, or if you're one of those age groups that I talked about before, going to the doctor or to your emergency department, if it's that severe, is definitely the first step, because you don't want to end up.
Of course.
There are medications to prevent it or to treat it once you have it, but it's much more effective to prevent it than to treat it.
Exactly, and that's what we're all about at 9 Health is prevention. Yes. So, all right, perfect. And then I know that there's some recent changes that have occurred with this pneumococcal vaccine. So can you kind of go over what has changed with that?
So all children, the children's vaccine, so that Prevnar 13 is still the same. So they still want the children to receive the 4 doses under the age of 2. What's changed is the over 65 recommendation, where the ACIP, and that's the Advisory Council for Immunization Practices, and they're always looking at the best ways to administer vaccines, the safest populations, making sure that our general public is covered by the vaccines that they should be getting. And so the recommendation changed so that all people should still get, or all seniors over the age of 65 should still get the Pneumovax 23. The difference is discussing with your doctor whether you need the Prevnar 13. It is, like I said, covering 2 separate strains. So the one covers 26 strains and the other one covers 13 strains.
Right.
So you definitely would want to probably get both, but it's a discussion to have with your doctor or pharmacist if it's right for you.
Right. Perfect. And then the for children, what are the vaccine recommendations?
So that's the children do not get the Pneumovax 23. That's only in older adults, and if you have certain medical conditions, like I mentioned, asthma, COPD, anything with sort of the lungs, because you want to prevent that infection. Children get the PCV13, or that Prevnar vaccine, at 2, 4, 6 months, and then 12 to 15 months, because, like I said, those children under 2 are really susceptible and can die from pneumonia.
Right, so it's really important to
get children vaccinated.
Exactly.
Yeah, or to vaccinate yourself to protect children.
Exactly, because it's not always about
No,
you,
it's
it's
not,
about
right.
protecting other
Your family,
people,
your friends,
people who
absolutely.
can't get the vaccine themselves.
Yeah.
So,
Yeah.
okay, perfect. And then can you get the pneumococcal disease or pneumonia from getting this vaccine?
No. So this is an inactivated, so it's not a live vaccine. You may get a little pain at the injection site, something that could be taken care of with Tylenol or ibuprofen. Minimally, you may get some fever, maybe a slight rash, but nothing nothing in the vaccine would cause you to get pneumonia.
Okay, so it's not going to be any worse
No.
or like nowhere near as bad as actually having pneumonia
Yes. No.
and
No.
dealing with all of that. Okay.
No.
And then can you go over a few more of the side effects of receiving the vaccine, just to kind of like reinforce it for people who are just joining us?
Yeah, so just like any medication that you put into your body, you want to be mindful of risk versus benefit, and as you just mentioned, that the benefits far outweigh the risk. The risks with this vaccine are very minimal. It's not a super painful injection. Any injection you can get can cause pain at the reaction site and just make your muscle a little sore for a day or two. Like I said, slight fever, possibly a headache, but any of those you could get with any sort of medication, but should go away in a few hours, if not sooner.
Yeah, that pain in the arm is pretty common for most vaccines that
but
you get.
You use it. You
right,
use
you
that
use it, you
muscle
move it
and,
around. So
and if it's that bad, take a little ibuprofen or something.
right, and that should dissipate.
But if you end up in the hospital with pneumonia, you're going to have a whole lot more needle sticks than
yeah, oh goodness.
and a whole lot more medications. So.
All right, well, this is Immunization Awareness Month, and vaccines are debated all of the time. So can you tell us, are vaccines safe?
Vaccines are safe, yes. There are a lot of groups that go into making vaccines safe. So the CDC is always looking at whether vaccines are safe. The FDA, in terms of their manufacturing, like I mentioned, that group ACIP are looking at the best ways to cover the general public and making recommendations on who should get it to protect those who cannot have the vaccine, those who are susceptible to these diseases, and of course yourself. So yes, the risk versus benefit for vaccines in general, and this one in particular, far outweigh the benefits, the benefits far outweigh any risks.
Okay, wonderful. We have a question?
So on Facebook, Susan had just said, I got both of those pneumonia shots.
Good.
So, which is great. Good job, Susan. But
Yeah.
is there, if you don't get both of them as an adult, are you more likely then to get pneumonia? Or, like, how does that work? It's not really a booster you're getting, right?
So it actually is. So if you, so the recommendation is if you've gotten the vaccine before age 65, you want to wait 5 years and then get it again after age 65, because they've seen that your sort of immunity to it has waned. And so if you get it again, you can boost your immunity and therefore have more protection. But yes, it is recommended that you get it again. If it was before 65, if you're over 65, you're done. You got your one shot of PCV13 and the one of PPSV 23, so Prevnar and Pneumovax, and you're covered.
And the changes with Prevnar, the recommendation is.
Yeah, the changes with Prevnar is still to talk to your doctor to get it. So they're not saying don't get it, not at all. And I would still personally recommend it because, again, you're covering for different strains of the pneumococcal bacteria, and always covering more is better. You can certainly get a strain that's not covered in these two vaccines, but these are the most common and the most sometimes deadly, and so you want to make sure you're covered with.
And then just a question from me. Would there be a reason your doctor wouldn't recommend getting it?
So in reading up on the new changes, there wasn't anything listed. They just said depending on what medical conditions you have. And so I would say that it would almost be the opposite. So if you are a smoker, if you do have asthma, if you do have COPD or something that would would make you more susceptible to pneumonia, that you would definitely want to get the PCV 13. And then the others, if you're just sort of normal and healthy, you may just get the Pneumovax 23 and be covered. But if you wanted that extra protection and you were maybe more susceptible, then that would be definitely reason to get the additional shot. They're given about a year apart.
Yeah.
And so.
Wonderful. Any more questions
No,
coming in?
other than that, people are just checking on their friends to see if they've gotten it.
Yeah, definitely.
Wonderful. That's
Definitely.
good. That's
yeah,
really
protect
good.
yourself, protect others, and especially those kiddos out there, and older family you may have.
Yeah, absolutely. And if you guys have any more questions, you can just type them in the feed. We will come back and answer them for you. Do you have anything else that you would like to add?
No, I love that you guys are doing all this immunization month, and all the vaccines that you've discussed already are super important, and this one is as well. And so get out there and get those vaccines and prevent disease. My goodness, it is so much easier to prevent disease than to deal with it on the backside.
Yes, prevention is way better than management. So, agreed.
I'm a healthcare professional, we love that too.
Yes. Well, thank you so much for joining us, and thank you guys for joining us on Health Happens this week. Join us next Tuesday at 11 for another health topic. And again, check out our website, 9healthfair.org, to find a fair near you. Again, they start September 10th and run all the way almost until the end of November. So be sure to check out the website. Thanks so much.